Genetic testing is about understanding your risks. Every one of us carries at least five gene mutations for diseases that can result in an offspring that is affected. Now, some of these are what are called recessive genes, so you have to have both parents contribute an affected gene, and some of them are dominant or primary, and therefore just one copy will result. So when you're planning your family, you want to know what is the risks that you're going to have. And once you know the risks and you know that you're at risk of having a certain type of disease affected child, there's ways to test in utero to see if the child is affected. There's opportunities for some newborn screening that will help you. And the key here is no matter what you decide, there's obviously certain decisions that may be more acceptable for people than others about how you handle that information. Having the information gives you power, and you can decide whether you want to intervene, whether you want to have a child, whether you want to adopt a child, what you want to do based on the risks. But without that information, you're flying blind. And it's so essential that you know it and you know it as early in your planning as possible. You don't want to find out when you're so far along in your pregnancy that all it does is create stress and uncertainty and limits your options. So that's the importance of screening.